Hi, Gwyneth from CNA. Two questions. One is a travel website in China said that over 10,000 passengers had arrived from Wuhan from the period 31st December to 22nd January. Does the government have this information and can it confirm? Also, would you be able to check the passport information, the stamps that have been issued, so that even if they are not from even if the passports are not issued from Hubei, if the passenger has gone through Hubei in the past 14 days, for example, is that part of the measures that ICA will be taking as well? Secondly, will there be measures in the upcoming budget to mitigate the impact on businesses, considering that the situation will last for a few months? And I'm going to pass it to Cheryl, my colleague.
I just have one more question in terms of are the measures also in response to some news that the incubation period, the virus can be spread during the incubation period, or are we just looking at these measures as a whole? Thank you.
On the first question, we are aware that there are travelers who have been to Hubei province and who would have come to Singapore and may still be in Singapore before the flight restrictions were put in place. These need not only be China nationals. There could be Singaporeans, there could be people from other nationalities who had visited Hubei, Wuhan, or any other city in Hubei province, and then are back here in Singapore now. So we are reaching out to all of them. I can't give you a specific figure yet because the operation is underway even as we speak. Some of them would have left already, right? And so we are reaching out, contacting them to make sure that they are safe, that they are in good health, that if they show symptoms, immediately report to the doctor, and monitoring their status. So we'll provide an update on this in due course. Number two, on whether additional measures will be put in place, and particularly for the budget. As I mentioned earlier, I don't want to preempt what is going to be in the budget, and this is not, I think, the forum for this, but we are very mindful that on top of all the defensive measures, the multiple layers of defense that we are talking about and that we have put in place and will continue to enhance as the situation evolves, there will be different groups who may need support and help. That will include specific areas of the economy which will be impacted, and I think will feel greater impact when the travel restrictions start to bite. So retail, tourism, these will be impacted. So we are monitoring these very carefully, working together with our economic agencies, and if need be, we will certainly respond, be it in the budget or as an off-budget package, right? So we will make sure that we have resources available to help support our businesses, vulnerable groups, as well as the economy. Thirdly, on the incubation period and reports that it is possible for the virus to spread before you show symptoms. We've seen the reports. We are in consultation with our medical experts on what the evidence for this is, right? Because I think this is still quite preliminary, and it's not, from my understanding, and we can get the medical experts to say a little bit more later, that it's not conclusive yet, right? But it certainly is something we are watching out for, because if indeed this is happening, then certainly we will have to do more and escalate our measures even further. But perhaps our Kenneth would like to say something?
We are mindful of the developments that are coming out from China and the news of how transmissible this virus is. The information continues to evolve. We've met up with our own public health experts and infectious diseases experts. Our assessment is the information still continues to evolve, and it's not conclusive enough for us to make immediate changes to our current posture in terms of the measures that we're doing. However, our assessment, in fact, is that the measures we have undertaken and plan to implement over the next few days remains appropriate, ready, and reasonable for the situation as we see it now. Just to affirm one more time, there's no signs of any community spread in the country. and we continue to track and look very closely for any evidence of that occurring. We are continuing to get more information from internationally, together with our colleagues in China and from the WHO. And as information comes in, more information is made available to us. We will continue to review the suite of measures we put in place, and that would include reviewing our case definitions, our quarantine measures, our contact tracing and testing measures as well.
So just to reiterate, the measures and plans that we have, as I said earlier, our posture is to be proactive, is to anticipate and move as swiftly as we can, but whatever action we take really has to be based on evidence, data, international medical guidelines. I don't think we want to be, on the basis of one report, two reports, not even sure if it's conclusive, we overreact and we overdo things. That's not the Singapore way. We stay calm. We have contingency plans in place for all scenarios. And if the need arises, we will escalate, we will put in place tighter, stricter measures. And we stand ready to do that, including sparing no effort to get resources and budgets and fiscal resources that will be needed to support these plans.
Let me ask Minister Masagos to talk about environmental issues.
Good morning. Our primary focus will be on cleanup exercise after incidents, after these incidences, so that the premises are well disinfected as well as properly cleaned. There's already, we have worked with MOH as well as the NCID to come out with the guidelines, what kind of substances to use, what kind of surfaces they should target, how often they should be doing it, and at the same time, the protection that the cleaners themselves must take. In addition to that, what to do with the materials that they use, the cloth, the cleaning materials that they use, how to dispose of it properly. In Singapore, we already have facilities to dispose of biohazards. So these are part of what we have to do to all these premises owners and the cleaners need to comply with. At the same time, we have also geared up at least 2 companies for now. If these premise owners do not know how to do it or would like someone more professional to do it themselves. But in any case, when MOH has directed for premises to be disinfected, whoever is doing the cleaning, NEA will go there to supervise.
Minister Chan Chun Sing would like to say a few words.
Let me add a bit of context to the question on the impact on tourism, which Lawrence have elaborated on. Especially for the international media, I think I've said this to the local media before, the Singapore economy has been diversifying over all these years. So the tourism sector is but one of the sectors in our overall portfolio of economic activities. And within the tourism sector, we have further diversified on 2 fronts. One, we have a very diversified portfolio of tourist arrival from different countries. No one major country dominates the portfolio. That gives us resilience to the economy. The second form of diversification within the tourism industry is that we have diversified to different types of activities. So, to your question, the group tours from China will be a small part of our overall tourism portfolio, which is a small part of our overall economic portfolio. So we have a handle of the numbers that we are dealing with. We think it is manageable, and we will step up our efforts to continue to diversify our tourism activities to different markets and different types of activities. Having said that, as I've mentioned in my remarks earlier, there will certainly be an impact on the tourism industry and the related industry. There will be a wider impact on the consumer and investors' confidence that we have to deal with. And as Lawrence said, we are ready to step up the measures to support our enterprises and workers and we have the means to it. This is one of those occasions whereby it's useful to note that over the years, we have a very prudent budget, a prudent financial management that can give us the depth of resources necessary to deal with such contingencies.
Takashi from Nikkei. Singapore government has found at least 5 falsehoods of related to Wuhan coronaviruses. And is there any specific reason that the government applied a POFMA to the only hardware zone cases?
Sorry, just to be very clear, your question is why we applied the POFMA direction only to the hardware zone case? Well, it's because that's the case that has so far emerged clearly with respect to the fact that there's a false statement of fact, which in this case, the Minister for Health has ascertained according to our current laws, and he is also satisfied that it's in the public interest to issue that correction direction. So that's why it's happened. If any others come to our attention, we will apply the same kind of evaluation and take appropriate action.
Hi, Nicholas from Yahoo. Minister Lawrence, you mentioned earlier that there's a need not to overreact or to turn xenophobic. Over in Malaysia, there's already been a petition to prohibit Chinese nationals from entering the country. Is the government concerned that such sentiments might take hold here as well? And how can it guard against that?
I think the petition is already happening in Singapore too. So it's not just in Malaysia. I mean, so we know that these sentiments may emerge. That's why we are wanting to reach out and assure Singaporeans that, look, we have in place a robust system. We have put in place measures as appropriate, and we will continue to monitor and do more if and when the situation escalates. It's a system that has multiple layers of defense. It's a robust system. But let's also be psychologically prepared. Right? It's important that people are psychologically prepared that this is not any system you put in place. Right? Given the nature of the virus, it will spread. We are trying to do our best to contain it and minimize the imported cases. But even at the start, we already forewarned and asked Singaporeans to be psychologically prepared that it would be a matter of time before we see the first imported case, which has happened, given that we are a transport hub, given the nature of air travel today. It will spread to not just Singapore, but other countries that it has already done. So I think we ought to have that mindset, be prepared that this thing may worsen, but also have the assurance that if we continue to stay united, work together with the measures that the government has and will continue to put in place, with individuals taking social responsibility for their actions and their own health, we can overcome this crisis situation.
Can I just say something? Imagine at the height of SARS and we were affected quite badly. Imagine it at that time, other countries say, get Singaporeans out of our country, and we become a target as well, right? So we are international hub. We can well be quite hard hit by such epidemics. So I would say, do not do unto others what you don't want others to do unto you. I think we all must tackle the problem objectively and effectively.
I think it's important for us to ensure that our measures that we introduce are appropriate to the situation. And I also should remind all of us that each country situation is very different. And so different countries may adopt different measures, but they all adopt measures that are appropriate to themselves. And we are monitoring the situation very closely to ensure that our measures are up to date, and we also take reference from recommendations and guidelines from the World Health Organization. So I think all these factors are taken into account when we decide on what measures to introduce. we have to guard against overreaction, and that will result in the more serious consequences. So I think it is important for us to always bear in mind that we must be appropriate to the current situation. And of course, as the situation evolves, we will need to continue to review and monitor carefully, and we may adjust our posture from time to time. The lady behind here.
Thank you, sir. My name is Siti from Kyodo News, Japan. So just now, earlier on, Minister Lawrence Wong was mentioning about extending discouraging people going non-essential travel to the rest of China. So I'd like to know, because in Japan, the government has established 4 levels of, 4 levels are multi-level. So there are certain zones which are more dangerous that we should not go, but others are less dangerous. So China is a very big place. And you mentioned just now that we shouldn't be like xenophobic, I think. So do you plan like to have like multi-level, like which level is like less which area is less dangerous? Sorry.
We already have a multi-level travel advisory, so we say avoid travel to Wuhan province, Hubei province. All right, so it started from Wuhan city, and then after that we said avoid travel to the entire province, and then for the rest of China, we say it's defer non-essential travel. Right, so it's in a way tiered.
Hi, Haziq from CNA Digital. Can we get an update on the 66 who have been identified as close contacts of the confirmed cases? Where have they been quarantined? Who are monitoring them? Are they at home or in the government-run facilities and all that kind of thing?
They are quarantined at different facilities. Some are at home quarantine. Some are quarantined at NCID, our National Center for Infectious Diseases. Some are quarantined at the hospitals. Some are quarantined at our government-run quarantine facilities. So there's a mix of facilities, and it will be appropriate again to the situation of the close contacts. If the close contacts are ill, they will be in the hospitals to be monitored, to be treated for whatever illness they may have. And those who are close contacts which are well, they may be in the quarantine facilities. And those who have facilities at home, they are able to quarantine them. We have quarantine at home. Yeah, so as I said, some of them may be symptomatic, so they will be in the hospital, and some will be in the NCID, including those confirmed cases. They are in the NCID as well. Some of them are in NCID.
Hi, Andrew from Mothership. So I was just wondering about the students who have been asked to evacuate their hostels at universities. Do we know how many have been affected, and what are the arrangements being made for international students with no alternative places to stay? Thanks.
Yeah, I was waiting for the question. If not, I'm going to ask it myself. We talk about just now our state of readiness. Part of the readiness is actually getting the facilities ready for quarantine. And so the education system also is also a contributor to part of this national plan. So for our IHLs, particularly universities, there are 3 hostels who are designated what we call GQF, Government Quarantine Facilities. So the 3, one at NUS, Prince George's Park Residences, NTU is the Hall 1, SMU is Block 83 at Prinsep Street. So I know there has been some chatter because the students have been asked to move out of those hostels while it gets cleaned up and become ready as a quarantine facilities. So I apologize to the students for the inconvenience. I seek their understanding. This is part of our national response. I think for the national response, as part of this national response, we just want to get the facilities ready. We hope it wouldn't happen, but should there be more contact tracing, more confirmed cases, there will be more contact tracing, and we will need the facilities. So it's better now, before it happens, hopefully it wouldn't happen, that we get the facilities ready. Yeah. There are a few more other hostels that are affected. I think MOE will separately announce them so that the students will be informed. So for the students, I don't have the number of how many are affected, but essentially for the foreign students who don't have a home here, they will continue to stay in the hostels. As for the Singapore students, we will encourage them to go home, to stay home during this period while we get the facilities ready. Yeah.
Sorry.
Oh, sorry, they'll be moved to a different hostel. So I should elaborate, sorry. For NUS, NTU, there are enough hostel facilities to accommodate the rest of the Singapore students. For SMU, hostel facilities are limited, so they'll be asked to go home. And SMU is in the city center, so I hope it will not pose too much of an inconvenience. But appreciate them, all our students, for doing their part in this national response.
Right, just want to clarify, so for the 3 hostels that have been designated as quarantine zones, how many people can they accommodate? And how many potential people being quarantined is the government planning for?
I don't have the numbers. Anybody have the numbers?
These are not quarantine zones, they are quarantine facilities. We are getting them ready, and I don't think it's a question of what numbers we have today, because as we have a contingency plan, we have drawer plans. We are already activating some to stand by, and if need be, we will activate more. We will ensure whatever it takes, right? If the numbers go up, we will have sufficient quarantine facilities to contain the situation.
Minister Chan, you keep talking about providing help to entities and to the economy. Could you give some details of what are you thinking about? When will they kick in? And then specifically to the taxi drivers who drove these people to the hospitals. 2 weeks quarantine means half a month's income that they will lose because of this. So could you talk about that? And then I have a second question to either Minister Gan or Minister Wong. Compared to SARS, right? How big is the problem? How well prepared are we compared to SARS?
Okay, let me take the first 2 parts of your question first. Some of the measures that we can take are publicly available, like as in the SARS situation. So, for example, we are looking at, for the tourism-related industries, some of the measures that we can take and we have taken previously include, for example, property tax rebate, reduction in the foreign workers levy for unskilled workers, the easing of the working capital through a temporary bridging loan. So all these will help to reduce the risk of the business being insolvent and leading to retrenchments. On the other hand, with the slower pace of the activities in some of those selected sectors, we can also take the opportunity to step up our training for the people involved in those sectors. Another example would be for the transport sector, we could reduce the business cost to the rebates on the taxes, fees, and dues for the transport sector. And this we will all study in detail. In fact, we have started work with the respective trade associations and chambers. Now, why we have not given a specific number yet is because of the following reasons. Number one, it depends on the severity of the situation. Now, every crisis is a bit different. So while SARS, haze, all this gives us certain baseline, it is not a template. It is a baseline upon which we can build on. The second thing I think we have to be aware is the second unknown that we have to be aware is the length of this crisis. For SARS, at the depth of the crisis, it was a very intense 3 months. Then after that, we were able to clear it. For this particular situation, we are still at the early stage of the development, and it will be premature for us to prejudge how long this will take. But I'm confident that working together with the TACs and the labour movement, we have the means to understand the depth of the impact and then to put in the necessary measures. Right. Just want to, perhaps my colleagues can talk about this and the medical professionals can add. You mentioned about taxi drivers. I don't want to scare everybody. We make a distinction between, in our policy response, we make a distinction between those with regular impact, what we call high-touch events, and versus those with transient one. I think we don't want to swing to the other extreme whereby we start to fear even transient contact. So we have a risk management matrix, and it's really a spectrum of activities. But if any of the taxi drivers in the unfortunate event whereby they are afflicted by this, or we will work together with the National Taxi Drivers Association, NTA, or the private hires associations to render them the necessary measures together with the respective companies. So we are in talks with the companies, we are in talks with the unions and associations So these are early days, but I want to reassure Singaporeans that our mechanisms are in place for us to kick in these measures as necessary. No, no. Okay. Which taxi driver are you referring to?
The ones who took the confirmed cases to the hospitals.
Okay. They are staying back in the home, right? If I correct. What's the latest on that particular incident that Salma is referring to? That particular taxi driver. We'll give you the details. Yeah.
Our assessment is that travel within taxis and MRT stations, in fact, is associated with very low risk of transmission. But nonetheless, given that there were confirmed cases that traveled by these transports, our concern is in fact to protect the taxi drivers because of their being in that environment and their continued exposure to many passengers coming in. Singaporean taxi drivers were affected by our quarantine measures, in fact, are quarantined at home. At this point in time, those who are on home quarantine remain on active surveillance.
So no income for 2 weeks, right? They can't go out and drive.
So this one will work through the National Taxi Drivers Associations and the taxi companies to render help as necessary. We fully understand and empathize with the situation.
Maybe Minister Ng Chee Meng will say something.
Well, not much to add except that, the driver is quarantined at home. Family is supporting him, and we're working with the companies for some of the relief measures that you mentioned about. Not policy yet.
So on the other questions that Salma asked, how big is this problem compared to SARS? The answer is it's still too early to tell at this stage of the virus outbreak. The medical experts tell us, as of now, that the virus is not as infectious as SARS. Fatality rates is lower, as of now. But the situation is evolving so quickly. And as you all heard from the Chinese health authorities yesterday, it is getting stronger, the virus is getting stronger, the number of infections are likely to rise. So I think we just have to be psychologically prepared that this can get worse than SARS. Not to mention the latest, some of you asked, what if there is a risk of infection spreading even before symptoms show, right? If that were to happen, I think the spread of the virus would be much faster. And because we are unable to identify and isolate, unlike SARS, which we had the means to because of the symptoms. Right? So there are many imponderables, there are many uncertainties, and we have to be prepared that things may worsen, that there will be more cases overseas, in China, overseas, elsewhere, other countries, including in Singapore. And as I said, be psychologically prepared that this may take some time to unravel, but be assured too that we have a system in place. And this goes to your second question, how prepared are we compared to SARS? We are better prepared. Because of SARS, we have learned the lessons of SARS. We have put in place inter-ministry coordination mechanisms. We have put in place drawer plans for a full range of different scenarios of the virus outbreak. And that's why we are confident in saying that we are better prepared, and we want to assure Singaporeans that we are, and that's why our message is keep calm, carry on with your lives, but all of us work together, take the necessary precautions, and we can overcome this together.
Maybe a last question.
Hello, my name is Sharanya. I'm from the Business Times. I would like to ask what steps is Singapore taking in terms of enhancing our treatment and testing capabilities for the virus? And specifically, are there any collaborations with private hospitals or pharmaceutical companies and also manufacturers of facial masks? Thank you.
From our experience with SARS, haze, and other situations, we have adopted the following posture. Number one, we make sure that in country we have the necessary stockpile. And at this point in time, I want to emphasize this. We do have the necessary stockpiles for the coming weeks and months, provided our people all work together and do not hoard the supplies. We should give priority to those people that need it most and not to hoard the supplies. So there is the stockpile strategy internally. The second thing that we have done over the years, and in fact I was in conversations with ESG and also NTUC Fair Price up till late last night, was to continue to diversify our sources of supplies. So the supplies of our masks come from a few countries, and besides China, we have also sources of supplies from other countries, and we are working with these suppliers to bring in fresh supplies. And of course, we understand in such a situation, China itself would also be asking the other suppliers to up their supply as well. So ESG, NTUC Fair Price, and other agencies, we are working with our respective suppliers to see how we can strengthen the supply chains with them. But at this point in time, we have diversified our supply chains, and that gives us a greater confidence than what we had when we were facing SARS and the previous haze episodes to diversify this. Now, having said this, perhaps just to bring the threads together about the supply chain and what Salma asked just now. In any of these crises that we are handling, we are not dealing with just the here and now. In fact, I must say that over the last 1 week when the HCG and the task forces have been set up, I'm very proud that the officers and staff from the various agencies are constantly thinking about the situation, the what if, 2-3 steps down the road, and putting in place the measures and the contingency measures as necessary. So whether is it quarantine facilities, there is a step-up plan, if you like. So it's not that these are the only facilities that we have. We always ask ourselves, if this is used up, what is the next line of defense and what's the next line of defense? And that is the way that we need to approach crisis management. It is not to go in and say that this is our plan and we will execute it. But this is a baseline, a basis for us to work on. Beyond that, how do we continue to build on layers upon layers of our defense, as what Lawrence have mentioned? So for the supply chain, it's not just only about masks, it's also about our medical supplies and the rest of the other supplies that we must make sure that we have a stockpile strategy, we have a source diversification strategy, and we continue to work closely with the producers to ramp up the supplies and secure those supplies as necessary. And the fact that Singapore is an international hub help us to do many of these things. But we must never be complacent, and we must always think about every aspect that can happen 2-3 steps down the road ahead of the situation and take the measures as necessary before the event actually happens. Thank you very much.